Hello, everybody. Welcome to the Mental Health Minute by Elite DNA, hosted by myself, Philip Cerrone, Chief Operating Officer of Elite DNA Therapy, and my co-host, Dr. Sharon Bloom, Chief Clinical Officer of Elite DNA. How are you, Dr. Bloom?
Good morning. How are you?
Very good, thank you.
So last week we talked about mood disorders. We had two guests from therapy and psychiatry. And today we're going to build on that topic with a unique angle, both personal and professional.
Yeah, we have one of our great therapists with us, Ashleigh De Palma. How are you, Ashleigh?
Been great. How are you?
Very good, thank you. And so, Ashleigh, you've been with Elite for a while now, so I've heard your experience, both, again, professional and personally, for a few times. And so can you just want to kind of talk to anyone watching about how far back you remember, having depression? And for those who don't truly understand depression, what is a day like for somebody who is depressed?
Sure. I was diagnosed with depression when I was 11, but if you ask my mom, I think it was probably a lot longer, a lot further back than that. Probably as soon as kindergarten, I think they started noticing symptoms. It started as irritability. I didn't have very many friends. I started to do pretty poorly in school. I don't think I ever did particularly well in school, but as I got older and started getting towards 11, 12, I really started having a hard time. I missed a lot of school. I didn't want to be around people very much. I did spend a lot of time in my bedroom watching TV, Unsolved Mysteries, if anyone remembers. So I spent a lot of time alone, a lot of time thinking about death and other things that probably aren't very pleasant to think about. And it eventually turned into thinking about, I don't want to be here anymore, things like that. There were times where I would gain a lot of weight because I would just sit and eat candy over and over again. I just didn't really have the motivation to do many things. I actually didn't get my driver's license until I was 22 because I just didn't have the motivation to do it.
And so has there anything, Ashleigh, that has helped you with your depression?
Of course, my family has helped a lot. They've been really, really supportive throughout this, and it's a lot of years that they were supporting me and they never once gave up. So that was something that was really special to me. Some other things that helped, of course, were antidepressants didn't work as well as I would have liked. I think they kept me out of a really big hole, but eventually I was able to get TMS treatment, which was really the starting point of my healing from depression. Now I spend a lot of time in nature and with animals and taking walks and things like that, and that's something that's really therapeutic for me as well.
And so, Ashleigh, do you have any advice for others who deal with depression, particularly in light of this ongoing COVID crisis? What is helpful or what they can do?
Sure. I think that if you notice that your children are depressed, I think that getting them help early on is fantastic. I wouldn't wait on that. If you see symptoms, I think therapy is fantastic. And if you need it, psychiatry is fantastic as well. I think keeping an eye on your children and just getting to know them and talking to them will help you look out for any warning signs. It's really helpful to be spending time outside, communicating with loved ones, even if you can't actually see them in person, spending time in nature, finding new hobbies to do. I think keeping yourself busy with things that you like to do so you keep learning and growing even when you're in a situation like this that isn't ideal.
And so, Ashleigh, now you have a very successful career. You have a lot of patients who really enjoy seeing you and you get really good outcomes from your treatment. And so what do you say for somebody who is watching at home, who maybe was in your situation when you were 11 or 12 or 15, whatever the case may be, who either has never tried anything to help with their depression, or maybe, like you said, who has, have been on antidepressants that have failed and they're at this really low point, whether it's related to COVID or not? What do you say to somebody like that?
I tell them not to give up because there is going to be something that works for them. I remember somebody telling me that a long time ago. You have to keep trying because there will be something that works for you. And what I would have missed out on if I had given up. So that's what I really tell my clients is to keep going, keep trying, keep looking at new treatments and new ways of feeling better, because eventually you're going to come up with one or some that are going to be great for you.
And to kind of throw a plug in there. And so for anybody who's looking to see you as a therapist, they can go on our website, elitedna.us, and can look up the information. They can reach out to us via email. They can call us at 239-223-2751. and ask for Ashleigh specifically as far as scheduling. And really start, whether it's through therapy or psychiatry, really start on a different path, right? On a path of improvement. So Ashleigh, I really appreciate you sharing your story this week. I know you're a big advocate of putting yourself out there, and so other people can benefit and hear your story as well. So I appreciate that. I appreciate you taking.
Thank you.
Awesome. Thank you both. As always, Dr. Bloom, thank you for joining me. And we look forward to you to the next Mental Health Minute. Thank you, everybody.
Thank you.
Bye-bye.
Bye.
Thank you. Thank you, guys.